Today we're doing something very different. We are actually introducing a new addition to the Dr. Mash office, and it is called PRO-NOX. The PRO-NOX nitrous oxide development has been around for several years. However, this is different than the one that is used in the dentist office. And Hallie and her patient are actually going to use this today to help alleviate pain, get rid of anxious feelings about the procedure. And Joan really did not want to do this procedure for several reasons, but mainly because she was so nervous about the pain. Are you a little bit better about this, Joan, now that we've told you what was going to happen?
Absolutely, I feel much better.
Great. And this is the actual machine that delivers the nitrous oxide. And PRO-NOX is going to do several things. It is controlled by the patient. In other words, Hallie, who is our medical esthetician, and I know you're familiar with her because she's done a lot of our Facebook demonstrations, is going to actually talk to her and have her utilize the machine. This is what she's going to breathe into and have the chemical go into her system. But one of the things that we really want to tell you about this particular treatment is that once the patient does have PRO-NOX in their system, it only takes about 5 to 10 minutes to take effect. Mm-hmm. And then when the procedure is finished, only 5 to 10 minutes for the chemical to go completely through the system so that the patient is safe to drive home. All right, Hallie, I'm going to ask you to start the treatment.
Okay.
And show us how the patient will begin administering to themselves the nitrous oxide.
Okay, well first I'm going to gel the cheek, the area that we're going to start on.
And is that gel an analgesic?
No, this is strictly just an ultrasound gel that we use during all therapy. You have to have a layer of ultrasound gel on for the treatment.
Okay, and so then she hasn't really received any other kind of anesthetic.
She has not. I do have some patients take an 800 milligram ibuprofen before we get started. Today we're just going to do the PRO-NOX though with our patient. Okay. So what I generally do is have the patient take 3 long, slow, deep breaths of the PRO-NOX to start before we get started. So you can go ahead and do that.
Now, how do you know when and if the patient is ready for you to start the treatment?
Well, this generally does affect them right away. When you mentioned the 5 to 10 minutes, that's how long it takes to leave after the treatment. But generally, when they take the breaths right off the bat, they're good to go. Yeah.
Okay, that's interesting. How do you feel, John?
It feels good.
Yeah.
I'm relaxed.
All right. So I'm going to start on this area right in here. I generally, if I'm doing a small section, I go through the whole section before I have them take another. Then I give them the opportunity to take another puff or two of the PRO-NOX. So, but when I do a larger area, sometimes I will give them the chance if they need to take a breath in between. Okay.
So this is to make sure that they have the pain under control.
Yes. Okay. So I'm going to start on the cheek here a little. You doing okay?
Mm-hmm.
So, Joan, do you feel it? Is it painful?
It's not painful. I'm very comfortable.
The PRO-NOX is really taking the edge off for the patient. Helps with nerves, anxiety, but it also helps with discomfort.
Now, what kinds of procedures or treatments can this be used?
This can be used with all therapy. This can be used with any of the fillers that we do here in the office. A lot of patients get very nervous with the fillers as well, with the discomfort.
So in other words, non-surgical, non-invasive types of treatments and
Yes.
procedures.
It really is such a game changer since we've brought the PRO-NOX on, because some patients do feel all therapy more than others. It really does vary from person to person. Some patients, now that we have the PRO-NOX, patients that have had this in the past that may have had more discomfort, it's good to know that we have this now available for them.
Let me ask you another question. Any of the patients
Would you like
that
to take a
in the
breath?
past experienced a
Oh,
little
no.
bit of discomfort, did they come back and then try it with the PRO-NOX? And
Yes, they have. We haven't had it in too long, but we have had a couple of patients.
And so they've
now.
said they totally see a
It
difference.
absolutely helped them get through this treatment much more than when they had it the first time. Okay. Would you like to take another breath?
I think I'm
You're
pretty
good?
comfortable.
Okay. Okay.
So really, she's only taken a few breaths of the nitrous oxide, and she's completely
Yeah,
comfortable.
like I said, it varies from patient to patient. I have some that really do need to take more breaths than she's taking. It just depends on their level of discomfort, which she's clearly doing pretty well.
Another question: does it increase the cost of the treatment?
It does not. We've included it in the price, which is the price that we've always.
So in other words, if a patient comes in and says, you know what, I'm getting fillers and I usually just get analgesic or anesthetic, that is a cream, and I prefer to do PRO-NOX, we're not going to charge them anything more.
With the all therapy, it's included in the price. Now with fillers, I believe there might be just a very small, like a $25 upcharge, from what my understanding is. Yeah.
Okay.
Because it's a very small amount that they need to use for fillers, whereas they use more in the room when it comes to a longer procedure, such as all
Okay.
therapy. You're doing okay?
I'm doing great.
Okay.
In a treatment like all therapy, which lasts probably, an hour for a full face?
Depending, if we're doing full face and neck, it can take 2 hours.
2 hours.
Depends. We're just doing a lower face treatment today on our patient.
So within that 2 hour period, how much nitrous oxide do you think a typical patient requires?
I've had patients that have needed to take breaths in between each area that we do. And then I've had patients like today where she really doesn't need it too much. But you're more than welcome to take a breath or two before we move on to the next section. Okay.
All right, in summary, because I know that we just promised our viewers that this would be a very short demo,
Sure.
introducing them to PRO-NOX. So to summarize, the PRO-NOX nitrous oxide is available to any patient that comes in for non-invasive and non-surgical treatment or procedure.
It is.
And they need to request it ahead of time?
I believe, I'm thinking, generally I would explain over the phone when they do book the appointment that they may want to use the PRO-NOX.
Okay.
I'm sure if someone were to be here and they weren't aware of the PRO-NOX, we can work it in though.
And if there is an additional charge with one of the procedures or treatments, that would be upfront, and the patient can actually reject or
absolutely.
accept it.
Yes.
Okay.
Yeah.
And again, to summarize, once the treatment and the procedure is completely finished, the chemical is out of the system within
They're fine to
10
drive home after the treatment. By the time they get out of the room,
and get dressed or
get out
whatever.
of, yes, they're good to go.
All right. Thank you,
So,
Hallie.
you're welcome.
And I will tell our viewers that this video will be up on our site on
Okay.
Facebook and in addition to Instagram for a while. And if you want more information, simply call our office at 484-351-8268, and that's in the description paragraph ahead of this video. And thank you for watching. Thank you,
you.
Hallie.
Thank
Thank
you.
you, Joan, for letting us
thank
invade your space.